Okay, so vasculitis in 30 minutes, everything you need to know, alright? So number one, I present a case where a patient presents to you complaining of a headache, okay, pulsating headache, older person, 60-70-year-old female with a right-sided headache. What do you think about? Huh? Giant cell arteritis. Previously used to be called, temporal arteritis, right? It's still now giant cell arteritis, okay. So when somebody presents like that, what are you going to do? You're going to start treatment straight off the bat? Do you want to get something else?
Yes.
First of all, you want to do an exam on the patient, right? You can go and pulsate the artery and the artery will be actually tender, right? Okay. Can you get something on labs to suggest? Because the temporal arteritis can lead to blockage of two important vessels. What are the two vessels? Central retinal artery and posterior ciliary artery. Both these arteries can actually lead to complete blindness. So that's why it is important for you to act fast. So when you say act fast, what do you need to do? Treat with steroids, right? But ideally for diagnosis, what do you need to do? Okay. Now temporal arteritis can be associated with another condition that actually gives you proximal muscle stiffness and pain. What is that called? Polymyalgia rheumatica. Proximal muscle, not weakness, stiffness and pain is going to be, okay? If you have a younger person, okay, younger female, comes complaining of, claudication pain of the arm and got some hypertension, what do you think about? You think about Takayasu's arthritis. How common is it worldwide? Not very common. It's more common in Japan. Okay, that's what the name comes from, Japan. Okay, when you think of Takayasu's arthritis, what kind of condition is this? We call it the pulseless disease. Why? It is affecting your aorta. Okay, so you get pulseless disease. Why? Because your aorta is getting affected, and therefore your subclavian artery, which comes from it to supply to your arms, is not going to get blood supply, right? And as a result, you'll have a discrepancy in blood pressure, and you'll have a pulseless disease. What else can happen with Takayasu's arthritis? These are things people probably don't know. That's Takayasu's arthritis. Now, there's another condition which can essentially affect any blood vessel in your body. Okay? It can affect any blood vessel in your body, but classically likes to affect skin, your GI tract, and the kidneys. And it's often associated with hepatitis B. Used to be more prevalent with hepatitis B before. Now the incidence of hepatitis B is much less because they've been treated so much. So it's less associated, but still associated with hepatitis B. In the skin, you'll get something called livedo reticularis. With the GI tract, you can call mesenteric ischemia, and with the kidney side, you'll get renal failure. What is this called? Okay, what if you got a young patient who presents to you with GI symptoms, arthritis, renal failure, and skin features? What are you thinking about? IgA, which is also known as Henoch-Schönlein purpura. Okay, so it's a vasculitis, typically happens in kids. You get GI problem because you're affecting your mesenteric vessels. You affect the renal vessels, so you're going to end up with glomerulonephritis. Okay, then it actually causes arthritis, and you're going to have skin findings along with a fever. How do you diagnose? Okay, so even though we call it GPA, granulomas everywhere on the biopsy, but kidneys, no granulomas. Okay, next you got MPA, which is microscopic polyangiitis. Microscopic polyangiitis is a close cousin of our first guy, which is granulomatosis polyangiitis. The important thing is, see here, there's no granulomas. That's why we're not saying the word granulomas. It's microscopic polyangiitis. So here, you'll have all the involvement that you would see with GPA, but no involvement of upper airways. So ear, nose, throat involvement won't be present. Greater than 1500. If you have greater than 1500 eosinophils, then you consider it hypereosinophilic syndrome. When you think of hypereosinophilic syndrome, what is the condition that should come to your mind? The mnemonic is China. C stand for?
B.
Starts with an M.
Mipo?
Mipo. Mepolizumab. Mepolizumab has been approved for patients with Churg-Strauss. Okay, but they're not going to say Churg-Strauss anymore. It's eosinophilic granulomatosis with polyangiitis. Okay,
What was the A in China?
Huh?
What was the A?
Atopic. atopic. The important thing about hypereosinophilic syndrome, one of the important causes is actually spondyloitis. And if you think about it, most hypereosinophilic syndrome probably you treat with steroids. But before you give steroids, when somebody's got hypereosinophilia, you must always make sure the patient does not have what? What drug is approved to treat oral ulcers with Behçet syndrome? Answer is... Yeah, very good. Apremilast. Okay, apremilast is going to be your drug of choice. Another drug you can potentially consider use is colchicine. We spoke about giant cell arteritis. We spoke about polymyalgia rheumatica, Takayasu arteritis, IgA vasculitis, hypersensitive vasculitis, granulomatosis polyangiitis, polyarteritis nodosa, microscopic polyangiitis, and eosinophilic granulomatosis with polyangiitis. Thank you for watching. If you like our content, please like this video, subscribe to our channel, and hit the bell icon so you get notified when a video is released every week. Have fun studying. We'll see you on the next one.